And we're live now. Thank you. Colleagues and friends, welcome to session 2. Some housekeeping before we launch into the session proper. We have a team of 4 collating some chats on the side, so please feel free to use the chat box and make comments and say hello from wherever it is that you're tuning in from. And we basically have 3 of our 4 speakers here right now, but we do have one other speaker that is having some challenges to tune in. So we'll, in the interest of time, we'll get a gradual start and as people join us. So this week we're focusing on 4 pillars, and that is integrate, include, inform, and sustain. This session falls under pillar 2 of this week, and it speaks to including and prioritizing the rights, the needs, and the capacities of the most vulnerable in our communities. And these include persons with disability. So just to double check that we are all in the same, in the right room, this session is titled The Shift to Locally Led Resilient Systems and Formal and Informal. So with formal systems, we're referring to government established and therefore government run systems. Whilst when we talk about informal systems in this space, we're referring to those for non-government, and this includes community or traditional-based systems. So essentially the 2 sides of the same coin. I think we can't get full utility from one without the other. So in this session, we asked the critical question of what is at stake? Should there be a shift in building a resilient system led by local actions? And what are the roles of other stakeholders within this system? So what is exactly at stake when we're engaged in such an exciting and at times very provocative discussion that talks about transformation, that talks about change, and essentially a fundamental global systems shift? Does a change necessarily mean that we do away with the old completely? Perhaps not. And more importantly, we can ask the same question differently, perhaps. What is there to gain? We know that change isn't necessarily bad. So how do we realign our ways of working, the way we collaborate with our partners, and how can we adapt towards a stronger, more robust solution that is sustainable at every level of our work, from community to global? How do we draw upon and capitalize on the strengths of the affected community? I mean, these are the very populations that stand to lose and gain the most during humanitarian crisis. So many questions to be answered, and in our brief time together, and to help us progress this discussion, we have a panel of 4 who will be reflecting and celebrating some of the work that has been conducted in the Pacific and how these systems have fared and weathered the global COVID-19 pandemic. So folks, we're really honored to have 4 guest speakers with us today. And they will each have 5 minutes to share and talk to specific issues and levels. We will have the global perspective, the community perspective. We are hoping to have the faith-based perspective shared by Dr. Una Tea, as well as sharing from the Fiji Disabled People's Organization from the perspective of persons with disability. We kindly request that you type in all your questions in the chat box, and we will collect these and have an opportunity towards the end to have a brief Q&A session. So folks, without further ado, I'd like to introduce our first speaker who will be sharing with us on from a global perspective. So Ms. Bhavya Srinivasan is the interim head of the network development at START Network. Bhavya joined the START Network in 2016 as part of the DEPP Innovation Labs program, which supports community innovation to strengthen disaster preparedness. Bhavya now works to support and champion the founding hubs to drive forward Start Network's ambition of systems change in moving towards a network of locally led humanitarian systems. Bhavya previously worked as an academic with a network leading on global research to reduce poverty by ensuring that policy is informed by scientific evidence from randomized controlled trials. Bhavya, over to you.
Thank you so much, Aggie, and it's a pleasure to be here this afternoon. I'm just quickly going to share my screen. I hope that's working. And for those of you who don't know Start Network, we're a network of humanitarian organizations from across the globe. And we are pushing for change in the humanitarian architecture. And I'm here to share our vision for change and would specifically like to thank Piango, who is our partner in the Pacific, leading and modeling the change, for inviting me to speak here today. So where did it begin? In 2017, Start Network paused and reflected on its achievements and the learning we had gathered through our innovative funding mechanism and programs, and we'd enabled collaboration and quicker response during crises. But there were still quite fundamental problems within the sector, and we believed that we needed to move away from a centralized system to one that was better connected to the front line. In fact, we wanted to go further to say incremental change towards localization was not enough. It needed to be quite a fundamental shift in the architecture and the system. And thus the idea of a decentralized network of hubs emerged. And these hubs would be the holders of power and resources, would be better connected and accountable to the communities and represent a locally led system that's best placed to respond to the needs of communities they serve. And by embedding localization into the infrastructure, you see the emergence of a paradigm shift. So we describe hubs across four key features that we have sort of identified. Firstly being hubs are collectives of locally led groups of change makers representing a diverse membership that is self-determined and not restricting membership or who's involved in these hubs to only one type of stakeholder, but to include multiple types of organizations. This could be NGOs, CBOs, private sector, etc. And all of these groups and these change makers shared a common vision for system change. And they test their vision in collaboration by implementing and working through programs. Ultimately, our idea is to form a strong peer network of locally led hubs that are held together and holding each other to account on a shared vision, on shared principles and values, all while sharing learning and resources seemingly across the network to really collectively push for change. When we started out, we were quite clear that hubs can't be designed by us, and by us I mean like the platform or the secretariat team sitting in London. And our role was to really support and facilitate, enable and accompany the co-design and co-creation of these locally led hubs. And we were also convinced that for this to actually succeed and sustain, it needed to be truly locally led and demand driven. What we mean by this was that it can't be a top-down secretariat-driven process by the Start Network. It really depended on change makers in the context, and we sort of took on the role to really back them and mandate them to take the lead. So to test our thinking and approach, we began working with 5 founding hubs on what we're calling a proof of concept. Pacific being one of the founding hubs, the others being India, Pakistan, DRC, and Guatemala. And this phase is designed to primarily be a learning phase for us to fundamentally explore, test, and build the basic infrastructure, the processes, the values and practices needed to launch these local hubs. The first thing we did was define what outcomes we wanted to test and work towards in achieving a common vision. And you can see the 6 outcomes on the slide. And our ambition is to share our learning and expand the network with the 5 founding hubs leading the way. Each unique in context, vision, and journey, and really demonstrating that there's a powerful and alternative model for localization, one that's locally led, driving change, connected and accountable to communities, and ultimately best placed to minimize suffering, loss of life and livelihoods, and to promote resilience in the form of sustainable and dignified responses in crisis contexts. Thank you, Aggie.
Thank you so much, Bhavya. Such a powerful sharing, talking about decentralizing power and resourcing. I really like your words about shared vision, shared principles, and shared values. And this is, I think, the essence of why we're having, or why we're engaging in this dialogue with all our partners. And so, folks, that's a really good segue to the next speaker that we have lined up. We have the perspectives of persons with disability, and we have Ms. J. Nasilasila, who is the Australian Humanitarian Partnerships Disaster Ready DRR Officer with the Fiji DPO. Ms. J is also the Fiji focal point of Shifting the Power Coalition, which is affiliated to the Family Pacific team. And Jay currently coordinates the Lombasa DCOS sector and is a volunteer at the Youth Champs for Mental Health and a strong advocate on disability inclusive DRR and response and recovery activities. Jay, over to you.
Thank you, Aggie, and warm Pacific greetings to everyone who are joining us in this call. Thank you so much for having us into the space. And first, my intervention today will be basically to reflect on understanding the preconditions to disability inclusion for persons with disability in humanitarian situations. It is really important in terms of discussions. The actions of humanitarian actors needs to consider to uphold the protection and safety of persons with disabilities in humanitarian crisis situations. And this, it is important noting the coordination with all our clusters and the National Disaster Management Office in ensuring an inclusive approach. Inclusive approach in the sense of identifying the numbers of persons affected in a disaster or during a crisis. Also the identifications of needs, and that is really important for us as it's key in the sense that using of the Washington tools. Also the importance to ensure adequate space. This is in regards to talking about the infrastructures for persons with disabilities in evacuation centers. For us, we know that most in times of disaster, we use schools and churches as a private options. It's options for evacuates people in the communities. So the importance of ensuring that it's accessible for persons with disabilities. In this discussion also, I'd like to bring in the highlights of assistive availability of a support mechanism for persons with disabilities during humanitarian situations. And most importantly, information, ensuring interpreters available. This is to do with the updates and how it is really important for persons with disability to be informed advanced information is critical as it allows persons with disability to better prepare. And also, it brings me to ask this question also: what will you put in place to ensure that persons with disability who are in shelters also enjoys the rights to the fullest, taking into account the different impairments? How will you ensure that all evacuation practice are taken care of, meaning accommodate the needs of persons with disabilities? Through our Disability National Emergency Operations Center, during TCASA and TCANA, we've noted that not much of persons with disability did make use of the evacuation center or use the evacuation center due to accessibility issues. So these are some of the lived realities and the highlights of persons with disability, of what we face during a crisis situation. And the importance of also understanding the intersectional challenges faced by persons with disability during humanitarian crisis. It is important for us to recognize that women and girls with disability, marginalized, they face multiple and intersectional challenge. And first, one of the things that we need to know is that persons with disability are mostly at risk during this time of crisis. Example, this is for women, children, young people, those with the psychosocial disabilities, and persons with diverse gender identity. And the continuous challenge, there are a range of issues that intersect the disabilities, including the geographic locations, those in rural, remote, informal settlements, mountains, those who live in the highlands, and also those who live on the streets and local communities. So it is also important for us as a humanitarian agencies to understand this and to know the different challenges that we face in our daily life. Already, persons with disability are being vulnerable in normal, in peace times, and when the crisis as such happens, it's further increase the level of vulnerability for persons with disabilities. And yes, what actions should we take to address intersectional challenge? Importantly, in the mainstreaming of intersectional opportunities, meaning to the other clusters, the NDMO, the Red Cross, and other agencies, humanitarian agencies that are leading the humanitarian work on the ground. Having a standard code of practice is important as humanitarian response to ensure that it incorporate disability inclusions into the work in a community. Yes, and given the cyclone forecast, in the past cyclone here in PG, the importance of what will our agency do in order to respond to the intersectional disability. Firstly, the importance of ensuring emergency preparedness plan are there, and it should include disability inclusions ideas. Existing data on disability, especially in low middle income countries, with scars are often poor quality. Yesterday's session, we had a session, we talked about the collation of data, and it's really important to include disability disaggregated data. Disaggregated data will really best prepare and support the work of humanitarian into the response, as it really it will really meet the needs of the different diverse impairments that exist in our community. And lastly, the most important thing that we emphasize as disabled people organization to our humanitarian partners and agencies is the importance of incorporating Washington Group sets of questions that can be used to identify whether some has a disability, as it's designed to use with adults for 5 years. And this question really does not diagnose disability or identify the cause of disability. And this should be done by medical professional. So the importance of why using Washington Group of question, like I looked earlier, to identify population most at risk. It also measures the participation of persons with disabilities and measures the extent of exclusion through programs and participation. Disability disaggregated data is critical in ensuring that actions, policies, procedures used by humanitarian actors are inclusive of persons with disabilities. As it also provides an overview of the needs and the scope of mobilizations that is it's needed to ensure that persons with disability are not left behind. Thank you so much again.
Thank you so much, Jay. Such a critical, lots of work that needs to be done for us to ensure that we are really making this a reality. And we're not just talking about inclusion, particularly when it comes to members of our community with a disability. And I like how you mentioned the multiple levels of work, the multiple levels that we need to enable. So this is a national conversation as much as it is an operational level conversation. I really interesting how you mentioned about the intersectionality, the multiple levels of that exacerbate this vulnerability. And so how we can as a sector, together with our partners, again, global, regional, national, and local, come together to try and see how we can work towards realizing some of the really key essential aspects of inclusion. So thank you so much for sharing. I know that the time is very little for us to unpack such a big conversation around that. But hopefully, folks, please do put in your questions into the chat box. And we're really happy to see that we have such a diverse listeners filling in from Germany, Kiribati, Samoa. Welcome all. Folks, we have, I'm not sure whether we have the Reverend Dr. Ungatea, who is supposed to be joining us this morning. Perhaps not. So what we'd like to do now is to go on to our next speaker, Ratu Randovimbua Tangivetua. So before I introduce Mr. Tangivetua, I just wanted to go back to what the Secretary General, Mr. Henry Puna, in his opening speech with the young people yesterday said, and I quote, "Resilience starts at home and must begin in the communities," unquote. And that's where we're going to go to. That's where Ratu Randovimbua Tangivetua, who will take us and share with us the perspective of the community systems. Mr. Tangivetua is the CSO liaison officer with the AHP group and the Child Fund Australia, TCIASA, which was activated in Bua, and is based at the PA's office at Nolumutua House in the Mowalu. Mr. Tangivetua is also a member of the Bua Urban Youth Network from 2007 to date. Randovi, please, over to you.
Bulre panelists, organizers, and audience attending this Pacific Resilience meeting in Fiji, the Pacific and across the world. Firstly, my name is Rondo Mbotang Wetawa from the village of Mbola Manikor, Tikina Mbua, and the Sana Mbua in the Northern Division. In December 2020, the Bono of Mbua was devastated by the second Category 5 tropical cyclone to ever hit Fiji after TC Winston in 2016. It decimated villages, destroyed homes, plantation, killed villages, and wiped out sources of livelihoods across our province. Barely a month later, as we struggled in rebuilding, second cyclone, TC Yana once again swept through the Fiji's northern division, and setbacks efforts already underway to rebuild our communities after this devastation of TCS. It was heartbreaking and gut-wrenching as we had to start all over again. And if it weren't for our traditional resilient system, we would have given up. In Bua, there is a concept of life that we immediately impact as a blessing when we greet people. It's a bulare. It literally means a good life. To me, this speaks to the traditional resilient system that we have in our Vanua. It means life is good or always good, irrespective of the challenges or changes we face. This was very evident when Bua, with predominantly rural, was hit by these two successive cyclones, one a Category 5 and the other a Category 2. The Fijian government was able to mobilize timely support from the National Disaster Management Office to the province, which worked with the Provincial Administrator of Mbua and the Roko Tuimbua's office to roll out assessments and deploy the appropriate support to communities hit hard by these cyclones. However, what I also observed was just how effectively and traditionally governance mechanism the Mbose Vano of Mbua quickly convened a forum allowing traditional leaders to gather and discuss both the impacts being felt across various clans and how to respond to the needs of the people. In the meeting, they also brought in a few frontline agencies to explain their strategies for the recovery. In my district, the Turanga Tuimbua led the efforts, but often sought advice, not just from traditional advisors, government officials, as well as the group of urban-based Mbua professionals called the Mbua Urban Youth Network. The BUI network mobilized in Suva and abroad for extra support for traditional leaders and worked with blessings of the Tuimbua. For most parts of this response, he tapped on traditional service systems to help catalyze recovery efforts across the 9 districts. I observed that this approach helped build unity and mobilized youth in the villages to work together to rebuild food security, to repair damaged infrastructure, in particularly water supply and bridges. In some villages, kava was harvested early as some were damaged during the cyclones and sold so that funds would go towards repairs. Of course, in the initial aftermath of the 2 cyclones, food shortages meant sharing the communal meal were commonplace, with designated cooks preparing meals for villages. We didn't spend a lot of time waiting for the help of the government. Sorry. We looked at what we could do to move forward and move forward with that. In the district of Wainunu, for example, where a village was flooded and inundated with mud and silt, will be relocated to a new site. Surrounding villages have pledged to provide wood for building new homes, and as I speak, the milling of these logs have already begun. This is the government is still preparing relocation guidelines, which hopefully mobilize finances for other aspects of the major operation. This is the power of Vanua resilience. Now, 6 months after TCIASA, if one has to travel past some of these villages and spend a day or night with these villages, one would be able to tell that two cyclones devastated their homes and lives within weeks of each other earlier this year. I don't say this to minimize the impacts that these disasters have had on them, but I highlight this to stress the resilient capacities within our Vanua. This is why Mbua is the land of the Mbulare. Thank you, Regi.
Thank you so much, Tundovi. It is wonderful to hear of the indomitable Mbulare spirit. And, you know, it talks to the human spirit to bounce back from adversity. And really wonderful to hear about the intergenerational partnership where we're mobilizing the young people during disasters. And, you know, the community, the essence of the community as first responders, and not having to wait for government, you know, which was coming anyway, as well as drawing on the support of our international partners. Thank you so much for sharing, Tundovi. Folks, in the interest of time, we shall continue, and I do see questions coming up on the chat box. We shall address those after our last speaker has shared. Speaking of partners, the church and faith-based organizations play such a critical and supportive role in the fabric of Pacific communities. And because of this critical role, we're really truly honored to have with us today to share her views, the Reverend Dr. Ungatea Kata from Tonga. Dr. Kata is the director of the Tupo Institute of Technology and is a renowned linguist in Tonga. She has been an educator for more than 30 years, having studied for primary and secondary school in Tonga, and then conducting her tertiary studies in Australia and New Zealand. Dr. Kata is actively involved in civil society groups, especially in relation to human rights and increased women participation in leadership in the Pacific. And more importantly, she is a wife and mother of 3 children. Dr. Kata, we're really happy to have you join us today. So I shall hand over to you.
Thank you very much, Nancy. I have been speak briefly on resilience in terms of the church or the involvement of the churches in discussions of resilience, and I think I will speak basically from the Tongan experience. Now I'm kind of so there's something about the camera being said here, so I'm not sure. I will just continue with my vocal microphone bit. In terms of the churches in Tonga, I think what I will bring to the table in this discussion is often developmental discussions is basically non-inclusive of churches. I think it's because it is difficult for developmental partners to often seen church perhaps especially in Tongan context to be involved, but as part of kind of the largest church in Tonga, the Methodist Church in Tonga, which is the Free Wesleyan Church of Tonga, for better or for worse, yeah, every village will have a Methodist church in Tonga. So when we are talking about resilience, often the churches are the frontliners for a lot of the people in the communities. So when we have developmental discussions, between the government and civil societies. And in Tonga, I understand that humanitarian systems involve clusters in which they are basically members of government and non-government or civil society organizations in these clusters. I do not think that they are inclusive of the churches. In terms of us discussing in the Pacific, something that really needs to be we can understand the Tongan. There are nearly about 200 congregations in the Free Western Church all over every single island. They are the ones who provide or people default back into using their resilience. And often these very handy answers are a little bit type of thinking church leaders have from a system, because it's a very hierarchical system. And therefore, personally, I feel that the church always seems to feel that a back foot when it's discussion of these resilience issues. And that is a challenge for developments to infiltrate or to actively encourage church leader in its action, although it may find it frustrating and very difficult, they must, because these are systems that of the Tongan use in terms of when there are climate. I understand time is of essence here, so I'll just put in an extra point before I leave. Education is critical for because the church in Tonga is the largest provider of education other than government. So it is a tool also for understanding of issues, and also for balancing of things that are entrenched in our system. Education provides the way in which there can be other alternatives. And it is something, you know, the church, on the other hand, fairly conservative system in its ideas, in its ideas, but this providing of education, on the other hand, is fairly liberal and allows critical thinking and other more positive ways of rethinking of ways in which we usually hold resilience activities. So I think, Aggie, I think this is, I think that one of the things here that is why our church is not in developmental spaces is because often they are not seen as they are too difficult, I think, for most civil society organization kind of thinking. They are fairly conservative in terms of theology, and that is what of developmental thinking is about. Resilience, be moved into the theology of current theologies of the thinkings. That is the challenge that I think needs to be really reviewed and rethought. I might.
Thank you so much, Dr. Carter. I couldn't agree with you more. And you know, the church and perspectives from the church is such an integral part to the equation. And again, as I said, it's about the partnerships, and partnership with the church, partnership with persons with disability, partnerships at every level, and how we can capitalize on all that to drive towards a more robust system. Folks, we are very mindful that we are running behind time, and we do have a couple of questions from the chat. The first one, we do have time. I think we'll just go to 3 questions that have come up. So the first question is, in the Fiji government and traditional decision-making mechanisms, how are the voices of women and other diverse people heard? Would like to hear some practices in place. Perhaps I think, Jay, if you could just quickly share with the group on one such example where persons with disability have been represented in the government spaces. Over to you, Jay. There is another question here, Jay. I think we've lost Jay, but a question perhaps towards Bhavya. Accountability to affected populations in the localization agenda. We're including communities in the design of programs that affect INPICAM, and if so, how are we doing this? So in terms of accountability in the decentralization, when we talk about decentralization of power and resourcing, accountability is such a big issue. So Bhavya, just in 1 sentence or 2, could you share your thoughts to that? Thank you.
Absolutely, and I think this is one of the key fundamentals of what we mean by a locally led system as well, that the communities then are at the heart of the sort of design without just being there as those being consulted or doing like traditional needs assessments, but actually being involved in the planning and in the designing and actually articulating what the problems are affecting them, and in some cases even thinking about how they can be part of the solution or even produce the solution, which you then sort of support to scale, right? So a lot of our programs and the way in which we are thinking about how these systems would work is that the locally led system will involve communities by default. So even if you take Piango, for instance, in the Pacific, Siale, who's sort of the exec director of Piango, always says we are the community and we do understand what some of the problems are. So when we are defining the problems, we are representing the community because we don't differentiate one between the community and those responding to a crisis, because we're not like a traditional INGO. So I think that's quite inbuilt into the way in which the system is, we think the system will be designed.
Thank you, Bhavya. We have another question here, and perhaps I'll direct this to Ndovi. In your experience, what are some of the, if you would say, outline 2 specific challenges from the community-led perspective? What are some of the challenges that you face? If we can have 2, please, Ndovi. Thank you.
Thank you, Kenichi. My experience, firstly, the main challenge we faced was we was trying to deal with the first cyclone. We were trying to recover from it. The second one came along. It was really difficult because the first was mainly strong winds, and the second was flooding. So it really tested us. But luckily for our, what you call this, our traditional Vano system, we were able to recover from it fast. Mostly because people wouldn't go past someone who was really in need. There was support everywhere. Thank you.
Thank you so much, Tundovi. Folks, we really do need to wrap up. Apologies that we've not been able to answer all the questions that have come through on the chat box. We shall, where we have emails and contact, be able to reach out and try and answer that if there is interest for those responses. Folks, thank you so much for joining us. And, we've had a panel of 4 speakers talking to really crucial needs in the Pacific. The need for us to draw upon and to leverage upon our key partners. So having these national conversations, this is as much a national conversation and a country level conversation as it is a global conversation. So, transformation means we need to be able to work together. We need to be able to see each other as equal partners. Intergenerational is such an important perspective, drawing upon the young people who will be our future tomorrow. And, leveraging on the existing and drawing upon, amplifying the strengths that we have already in our region and in the communities, and realigning, adapting that together, and, essentially enabling each other towards a more resilient and more stronger system. Folks, thank you so much for joining us. We will leave you here, and we hope that you enjoy the rest of the week. Modemanda.